Today we are discussing the signs and symptoms of stroke, how to identify our risk factors, the latest in treatment options, and the importance of calling 911 if you believe you're having a stroke. And joining me today to help answer our questions is Dr. Prateet Patel. He's board certified in vascular neurology, and neurosonology at Capital Health. This is Capital Health Headlines, a podcast from Capital Health. I'm Scott Webb. Doctor, thanks so much for being on today. Let's talk about stroke and what are the signs and symptoms of stroke?
Most common acronym we use for stroke signs and symptoms is FAST, F-A-S-T. F standing for facial droop on the one side, arm weakness, again on the one side, speech difficulty. It can be either trouble finding the right words or coming out with the jargon of nonsensical speech. And T stands for time to call. Other signs and symptoms can be numbness or lack of sensation on the one side of the body, sudden onset difficulty with the balance, or very severe vertigo, meaning room spinning sensation that persists irrespective of position. On uncommon occasions, somebody can lose a sudden consciousness without any other cause leading into it, can be the symptom of one of the severe strokes.
And doctor, who's most at risk for stroke?
Most commonly, stroke affects people with conditions called atrial fibrillation, in which heart beats irregularly. Other risk factors include high blood pressure, diabetes, people who have carotid artery stenosis, the artery that supplies the brain, the narrowing. Overall, tends to affect more elderly individuals after 50s and 60s, but no age is immune. Even younger population is at risk of having strokes.
And doctor, what are some suggestions you have for minimizing our risk of stroke?
The best thing a person can do is visit the primary care regularly, have their blood pressure checked, and if somebody has a history of high blood pressure should be controlled in a normal range pretty aggressively. Other thing people can do is don't smoke. If they have diabetes, control the diabetes. Live healthy life, regular exercise, and eating healthy, either Mediterranean diet or overall heart-healthy diet would be recommended.
So let's now talk about the latest treatment options for stroke, especially endovascular procedures that help you avoid traditional open brain surgery.
Yeah, so in last few years, the treatment of stroke has evolved pretty favorably. There are two main treatments in the acute setting. One is intravenous medication, which is a clot bursting, strong blood thinner, which is supposed to be given within 4.5 hours from the last known well of a person. And the second is endovascular treatment, in which procedure is performed either through the artery in the wrist or in the groin. A catheter is passed within the blood vessel under X-ray guidance to reach the blood clot that is blocking the blood vessel in the brain and pulling that blood clot out mechanically and visualizing that blood vessel is open with X-ray in the brain. That being said, this treatment option is only available up to a certain time period. So as soon as somebody notices the symptom of stroke, either themselves or family member or friends or coworker, they should call 911 as soon as possible. I would not recommend waiting on those symptoms to resolve by its own or calling a friend or a neighbor. Just reach out to your phone if possible and call 911 right away.
And doctor, have you found during the pandemic that people just aren't calling 911 even when they're experiencing signs and symptoms of a stroke?
Interestingly, the milder strokes we are seeing less often in the hospital. Perhaps people with less disabling symptoms, maybe just facial droop, numbness, or mild weakness, are not coming to the hospital. And we have also noticed people with more severe stroke symptoms might be delaying their attention to the healthcare, maybe fear of COVID-19 or with the hope that with time symptoms may improve. But again, I would emphasize that faster the treatment, the better in these circumstances.
Yeah, we know that they say, you mentioned FAST earlier and that acronym, and we know that time is brain. And, that's something so important for people to do is to call 911, to not delay care, any fears that they may have about COVID-19. As we've learned, the hospital is a pretty safe place. Everybody's wearing full PPE. That's the best place to be if you are experiencing a stroke, right?
Correct, yeah. Hospital tend to have a significant amount of resources allocated to keep the patient safe, especially in the COVID-19 setting. Isolation of people who are already known to have infections or people whose COVID-19 test is pending. So I wouldn't worry about the COVID-19 infection. You are much more likely to be affected by stroke rather than COVID-19. And speaking of time, if I would phrase it again, about on an average 2 million brain cells die every minute in the cases of stroke. So I would not wait if I'm having stroke symptoms.
Anything else you want to tell people today about strokes, risk factors, minimizing their risk, treatment options, anything else we can tell people today?
So the treatment, if somebody is suffering stroke, I would say the treatment has become much more safer and advanced in the last few years. The endovascular option, as you mentioned, the treatment is called mechanical thrombectomy, in which we either mechanically suck or trap the clot out of brain to restore the circulation, has effectively turned many patients' life in a positive direction. Instead of unable to ambulate or unable to talk from the stroke, if that person receives treatment in a timely manner, they can return either to your normal life or become functionally independent. So again, time is brain, and get to the hospital as soon as you notice the symptoms. In recent years, the indication for the treatment has prolonged the time window. If you hear that this treatment options can be offered up to 24 hours from the last known enoma, which is true, but again, if you present within first few hours compared to 24 hours, you're likely to do much better in terms of outcome rather than waiting up to 24 hours, even though we may offer the treatment option up to 24 hours.
Right. As you say, it may be possible up to 24 hours, but the sooner you get in, especially within a couple of hours, that's best. And a lot of the lasting effects, physical effects, neurological effects of stroke can be reversed if we can just get people to call 911 and seek treatment early, right?
Correct.
Well, Doctor, it's been so great having you on and your expertise. Thank you so much for your time today, and you stay well.
Well, thank you so much.
If you or a loved one is experiencing signs of a stroke, call 911 immediately. And for more information about Capital Institute for Neurosciences, visit capitalneuro.org. And if you found this podcast to be helpful and informative, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. This is Capital Health Headlines, a podcast from Capital Health. I'm Scott Webb. Stay well.